Hi everybody, Dr. Jackie here. I'm so glad that you're here joining me today. And we're starting a new series and we're going to be here every Thursday at 7 p.m. So hopefully you'll be able to join us. And the series is called Rediscovering You. And it's really for helping women optimize their health, their wealth, and their well-being, because we all deserve to live optimally and have the life of our dreams. And I also, this has something to do too with my own personal journey of pain and loss, and having to live and rediscover who I was. Even though you think I thought I knew who I was, I really didn't, and I had to kind of delve deep and leave things behind that didn't really serve me and help to rediscover what I really wanted and really live the life that I want. My passion and practice is treating women in chronic pain, and that's what has really brought me here. So the many years of treating women in chronic pain, my own personal journey, has brought us to this Rediscovering You series. And this week we are going to talk about fibromyalgia. Fibromyalgia, as you may know, is a chronic pain condition, and sometimes I know you may feel like you need to have a little badge around you that says, I have fibromyalgia, and it's real, and it's not imagined, because you don't look sick. And I'm sure you've heard that. Well, you don't look sick, you look like you feel fine. I've even had people who've had handicap decals, have people actually come up to them and say, you don't look sick. Why do you have that? Oh, I just can't imagine that. But that happens. And I know that you are not well, and I know that it can be debilitating, and I know it's real when you feel like you can't get out of bed in the morning, and I know it's real when you can't play with your children, and I know it's real when you don't have the energy to complete that project or work or go to work. Or I know it's real when your day revolves around your pain and not around what your dreams and what you want to do, and serving and loving and being with your family and your career and really achieving what you want. So we know that fibromyalgia is a real thing, and we really understand it. I think some well-meaning doctors, and myself included years back, didn't know exactly how to treat fibromyalgia, didn't understand what it was, tried to put it in our own little box. I remember my very first fibromyalgia patient. Her name was Nancy. She came in with back pain. She came in with fatigue. I tried to put her in my little box saying, I know what to do with that. I'll adjust you. I'll do some therapies. You should feel better. 20 minutes later, how do you feel? She's like, I don't feel any better. Like, really? And I knew she didn't. And that set me on the journey to understand fibromyalgia, to really know how it works. What happens a lot with patients I see is they've been to other providers who very well-meaningly treat the symptoms of fibromyalgia. So you may get one medication for your headaches. You may get another medication for your irritable bowel syndrome. You may get something else or have another treatment for your muscle pain. You may get another treatment for your brain fog or your insomnia, or on and on and on and on. So you can end up with a whole handful of pills, a whole lot of doctor bills, and you still have fibromyalgia. You still feel bad. You're just treating symptoms. You're not treating the cause. So you have to step back, or the doctors have to step back and look and treat the cause, or treat the real condition, which is the fibromyalgia. So we have to treat the fibromyalgia. Fibromyalgia is a chronic pain condition. What I have found is it usually starts with a trauma. That can be an emotional trauma. That can be a physical trauma. That could be a surgery. It could be being under anesthesia, a number of different things. And those traumas just layer on top of each other until it gets expressed as fibromyalgia or chronic pain. And it could be a different autoimmune condition that gets expressed. And very often, fibromyalgia patients will have a number of different, usually autoimmune conditions that get expressed. Their body is trying to fight its way out of it. And what we see with chronic pain is it's centered in an area of the brain called the amygdala. And the amygdala, I like to call her Amy. She's always on guard. It's the part of the brain that that scans the environment. It is looking for anything that might harm you. Your brain is really designed to protect you. It's not designed to make you happy. It's designed for your survival. It's designed to get you from one day to the next day. And your brain is also a creature of habit. So if you get from one day to the next day, even though you may have fibromyalgia, it may keep repeating that pattern because that's what it knows how to do. So the brain of a fibromyalgia patient, the amygdala, Amy, of this fibromyalgia patient, the volume is turned way up. It's a 10. Everything is a threat. That's why someone can come up to you and hug you, and that really hurts. Just that touch is perceived by your brain as a threat. And it over-responds to that stimulus. It will over-respond to the slightest things. What we have to do is we have to go in and turn down the volume in that brain of the fibromyalgia patient. We do that in our office a number of ways. One of the main ways we do it is directly with neurofeedback. It's fantastic for rewarding your brain for good behavior and changing that brain without side effects, without negative side effects like you may find with medication, and it's permanent. But there are other things that you can do, and I'm going to give you a few tips today to help reset your brain, to help your brain look at its day through a different view, and really to do that intentionally. So when we intentionally have our brain know what to expect, it seems to want to follow that a little bit better than just being in a reactive mode. It also lowers your cortisol level, which is your fight or flight hormone, and that helps turn down the volume in the amygdala too, just not having that anxiety. So there's a few things that you can do. One would be to set your intentions for the day. And set your intentions for the day the night before. I used to do them in the morning. Now I do them the night before. Lets my brain know what I'm expecting for the next day. And they don't have to be big intentions. They don't have to be monumentous advancements. It's not supposed to be that. And really, it's not even really about accomplishing those tasks the next day. It's really just about letting your brain know this is what I would like to do tomorrow. And you do them the night before so we can use that sleep to help get your brain to filter that subconscious, this is what's going to go on the next day. And then it has it sets an intention, it sets the agenda, it knows what to expect before you even get out of bed. So that's helpful. 3 things that you'd like to get done. Play with your child, or finish that project at work, or check a couple boxes off that project at work, or plan your menu, go to the grocery store, whatever you would like to do for that day. Rest, do something that's nice for you. Try to include something in those 3 intentions that is healing and nurturing for you. We're always nurturing everybody else. Do something that's nurturing for you too in those intentions. Okay, so that's number 1. Second thing is I like to use that 5-minute snooze that I have before I jump out of bed to imagine my perfect day. Science has shown, and there's studies that show, that your brain really doesn't know the difference between what you vividly imagine and what you actually have done. So before I even get out of bed, hit the snooze. I got 5 minutes before it goes off again, and I am going to imagine with feeling and emotion what my very perfect day would be like. My hair looks great. I got the best outfit on I really like. I look really good in my clothes. I'm going to go to work. I'm going to get there early, and the yoga class is going, and everybody's doing great, and all my patients are really happy, and my staff is happy, and everybody does great with their treatment. And I come home at night and I had a great dinner, and my kids are doing well. You just imagine. It may seem over the top, but brain doesn't know the difference between what you vividly imagine and what actually accomplished, and it tries to set out to accomplish that. And at least it doesn't wake up with anxiety about what you've got to do today and what's got to go, and I got to get up, and do I feel like it owes us. I'm just going to sit there and imagine. You can look on my Expressing Optima website. I have a little blog on the science of daydreaming, and it's really interesting. So it does make changes. Your brain will try to go out and accomplish what it sees as vividly imagined as well. And, you know, you just feel kind of better. It just helps you kind of go, hey, I'd like to try to do some of that. So I'm gonna vividly imagine that. Also, morning time is a lot of inflammation likes to settle around your joints when you haven't been moving them. So before your feet hit the floor and before we start that process of, oh, that hurts, to your brain, to your body, and it thinks that that's the way that it starts every day, we want to tone that down. And you can just pump out some of that inflammation. So flex and point your toes, roll your ankles around, pull your knees to your chest, bring your arms across, just stretch as many joints as you can, stretch your neck, forward, back, side to side. You can even do these stretches in those 5 minutes that you've got that you're vividly imagining your very perfect day. And what that does is it just helps pump that inflammation out of the joint that has settled there because you're not moving it. I know lots of times you may feel stiffer in the morning or stiffer when you've been sitting in your chair for a while and then you go to get up and move. But we don't want your day to start like that. We don't want your day and your brain and your body to get conditioned to feel that most pain first thing in the morning. It begins to think that that's just normal. This is how we start our day. We don't want it to do that. So those are the 3 things I'd like you to try. Set your intentions the night before. Imagine your very perfect day with feeling and emotion, just those 5 minutes, and stretch and pump those joints before you get out of bed. And understand that we understand chronic pain, we understand fibromyalgia, and we're going to keep continuing this every Thursday, 7 p.m. This month we're talking about fibromyalgia, and we'll continue on. I hope some of that is helpful. I hope you try it. If you have any comments, put them down in the bottom. I will get back and we can chat about it and share this with anyone that you'd like to. And have a great day. Thanks for joining me.